What's really going to be the impact is the increase to uncompensated care to hospitals, particularly in states that are already facing budget issues where there may be further reimbursement constraints. California is top of mind. I think our concern there is one, California also has rural communities, which have a different payer mix, right? Your rural hospital draws more from Medicaid and additionally has undocumented citizens, high number of undocumented citizens. So if these proposals related to undocumented citizens go in effect immediately, which now the bill calls for it, right? You're going to see an uptick of uncompensated care, which has been a downcrease since the COVID pandemic. But you're going to see an uptick. And what will that do to hospital finances? I think that is the real bread and butter here as far as what this bill will do.
Do you think most of those healthcare provisions are baked and that the Senate will look to adopt much of the work that House Republicans have done? Or do you think there's areas where we're likely to see significant changes in the healthcare related provisions of the one big beautiful bill?
So I am a self-proclaimed Senate snob. I will fully admit to it, but the Senate is going to change this bill. And I think for the House optics, you are having your moderate members potentially make some very hard votes. So it's going to go to the Senate and it's going to change. Thune already said we are going to hold markups. We have our own provisions, how related to clean energy, of course, an impact of rural districts. But as far as healthcare, right, provider taxes from a state perspective, it's different if you're a senator, particularly if you're up for re-election. I think the biggest voice we had against Medicaid cuts is obviously Josh Hawley, who is very into healthcare. But he says, I don't want any Medicaid cuts, right? Well, that's a difference. And why is that a difference? Well, Missouri, I believe South Dakota, and Oklahoma adopted Medicaid through constitutional amendments. And they also have the requirement, of course, of being budget neutral. So that is going to matter differently from a senator than rather from your district. Also, Missouri in 2005 already tried to implement Medicaid reform from a structural standpoint. So I think that residual nature from a constituent point of view, it's going to matter to Hawley. And not only that, you have Collins and Murkowski, a potential throwing your side of McConnell. So it's definitely going to change. It's just a much of how much does it change and when will it change? And then are you going to have it go back to the House, of course? By law, you have to pass the same bill and have your moderates potentially make another hard choice, have another series of votes, right? We've spent 6 months of this year, starting further from the election. We spent that much time on this bill. And once it's implemented, will the constituent feel anything different? And I don't think so.